We spend a lot of time judging people for their habits, people who smoke, people who use drugs, and when we have initiatives like this, we have an opportunity to have different conversations. I look at this sort of issue as being a healthcare problem and not a social problem.
Hi, and welcome back. I'm Sheldon McLeod, and this is Thinking Out Loud here on the SaltWire Network. I've been taking some mental health resilience training, and it's in the context of being a volunteer, and it's a really important thing for a lot of us to kind of, I guess, understand how we process and deal with the things that are happening around us. And Statistics Canada will tell you overall crime rates, all of that are going down, but it's just with this constant flood of information, it's really easy to probably just be overwhelmed and to get the feeling that things are really bad. There are people out there willing to help, looking to help. I know the province of British Columbia has had a real tough time trying to grapple with an opioid epidemic, but it's something that's touched us here in Nova Scotia. We're not immune to that. In fact, there's been a program that has been delivering free naloxone kits through Nova Scotia pharmacies for a couple of years now. And what was interesting to me was a recent news release from the folks at Nova Scotia Health, and that they had somehow obtained some naloxone kits that, as they say, did not contain the critical dose of naloxone. So this is why we're talking about this today with Ashlie Cormier, and she's with the Nova Scotia Health, Mental Health and Addictions. I think I need you to explain exactly what your title is for us, Ashlie.
No problem, Sheldon. So my name is Ashlie Cormier, and I'm currently the Provincial Manager with the Prevention and Health Promotion portfolio within our Mental Health and Addictions program. So that is provincial in scope. So there's one of me, and I support lots of different team members who sit throughout the province. And one of the initiatives that is part of this portfolio is our take-home naloxone program.
So is that an accurate number, around 9,000 kits handed out province-wide in 2022?
Yes, that is. Yeah. So we've expanded the program quite significantly over the last couple of years.
Now, they're handed out a very brief training session. The pharmacist will go over what's required to make it work, how it works, what it does, and when you should use it. And I'm curious about how you follow up. It's anonymous for the most part. They don't take your name. So do you have any idea how many of these kits that we're talking about went out?
So one of the biggest principles for this program is to be barrier-free, and so for access to the kits themselves to be barrier-free. So at this point in time, we have over 420 locations across Nova Scotia where individuals can access these take-home naloxone kits. So that would include pharmacies as well as a number of community-based organizations that are involved in partnership with the program. So that is one of the most important principles, is to be barrier free. And so with that being said, we do work with a distributor who helps to get the kits out specifically to the pharmacy locations in Nova Scotia. And so part of their process in terms of the role that they play in terms of helping to actually distribute kits on behalf of Nova Scotia Health is to identify the different locations where those kits are shipped. And so through that partnership and our distribution site, which is McKesson, they were able to help us identify the specific pharmacy locations in which these kits may have been shipped to. And so we were really able to narrow down the potential implications of the kits without naloxone based on that strong partnership with our distributor. So they've been incredible in terms of helping us to be able to identify this issue.
And when did you find out? How did you find out?
So actually, we found out it would have been a week to go today, Monday. And what actually happened was a local pharmacy that had just received a shipment was doing some quality checks of their kits. And so when they opened the kits, they identified that the naloxone was actually missing in the kits that they had just received. And so they notified our distribution site to let them know of the quality issue that they identified with this and held the kits immediately. And so our partners at McKesson then reached out to us at Nova Scotia Health, and then we right away contacted the Pharmacy Association of Nova Scotia, as well as the supplier who provides the kits to us. And so that action all happened simultaneously right away as soon as we identified the issue.
Right. Do we have any idea now how a naloxone kit could be shipped without naloxone in it?
So I would have to defer to the supplier themselves to be able to really provide the specifics on the error that occurred. It would be something to do with their production, and so it was a technical error from all accounts that we can see. And the most important thing for us here is that the public knew right away. So we didn't have a full understanding of the scope of the issue, but from my personal point of view, and I know the point of view of our program, was that even one kit that got out that potentially did not have naloxone in it was too many. And so we had to make a decision to notify the public right away, just to try and mitigate any potential risk or harm that could be associated with that missing naloxone in the community.
And do you know if there were kits that were distributed that did not contain this antidote?
We haven't heard from any of our pharmacy partners at this point in time that any had made it out to the public. And so we're really hopeful that because of the quick action and rapid response by all of our pharmacy partners and our folks at the distribution site at McKesson, that we were able to contain those kits. We're in the process actually right now of collecting some further feedback from the survey or from the pharmacies that were involved to help to really narrow down if any kits at all made it out into the hands of the public. So we've been doing a lot of information back and forth with all of our pharmacy partners here over the last number of days.
And they're free for anyone who wants to pick them up. I assume, though, the province is paying for them.
Yes.
Is there reimbursement? Are they providing replacement kits? I'm just curious as far as taxpayer goes.
Yes, absolutely. So there will be no cost incurred by us as Nova Scotia Health or taxpayers. So the supplier is responsible for providing us with new kits that contain the essential naloxone that we need. And so we're in the process of getting additional kits as we speak. And we had a large shipment coming in last week right around this time. So we've been able to help to get some additional supplies out to the community already.
And please take this as a compliment, but to have something potentially as embarrassing as this, or even life-threatening, to recognize it and to flag it in a public way, that is something that I think more agencies and departments should do. And congratulations for being forward and bringing this forward and even agreeing to speak with me about it. And I do appreciate that. And I'm wondering now, how do you calculate lessons learned, what to do in the future? How can this be avoided in the go forward basis?
Yeah, so we've fully engaged all of our procurement partners within Nova Scotia Health to work directly with the supply chain aspect of our program. And so getting the supplies is obviously a critical aspect of this program, but from a harm reduction perspective, making sure that we maintain trust and integrity within the community is also extremely important. So we need to continue to work with all of our partners and to work with the public to make sure that they know that these kits are there and they can access them when they need them. And we'll be really working closely with our folks in procurement to get everything running extremely smoothly going forward. And I can personally say that there were lots of lessons learned, but from a Nova Scotia Health standpoint, I feel we absolutely did the right thing by getting the information out there to the public as soon as we were made aware. And I'm proud that we moved forward with that action.
And the naloxone program itself, is there any way to know how effective it has been so far and how potentially life-saving it could be going forward?
Yeah, so we actually have a very robust website that is available for the public to be able to go on and look at the distribution sites that we have, the number of kits that we've passed out over the last year, as well as the numbers that have been reported in terms of being used actually for somebody who was experiencing a poisoning. So given the sensitivity of this topic, not everyone is comfortable self-reporting that information, right? So we know that the numbers that we have available likely underrepresent the number of kits that have actually been used. But I can tell you, just based on the data that we have, that at least 500 overdose prevention kits have been used within the past year. And again, I know that that is likely underreported data. So we know that these kits are saving lives, and that this program is extremely important. And, one of the other things that we've recognized over the last number of months here in the province is there have been a number of drug alerts that have been going out to the public as well. And we post those all on our website, as well as through all of the social media pages that we have. And so again, it's really important that we make these kits available to people who need them, and that we follow our principles of harm reduction here in the province of Nova Scotia.
And for people who may not understand exactly what naloxone is, I know we've kind of assumed people know what we're talking about here, but for people who don't know what naloxone is and how it works.
Yeah, so the kits that we provide in particular are through an injection. And so there's actually, so within the kit itself, there's some medical supplies that are included, including a couple of needles, as well as a vial, pill bottle that has 2 vials of naloxone. And so it's a substance, a drug that is administered to people who are experiencing an opioid poisoning, and it can help to reverse the impacts of that. And so it's a life-saving drug that is available to those who need it here in the province.
And the folks in the business of harm reduction will also say, don't use alone. Make sure if you're using a substance that you're not familiar with, all of those things that might, for people who are not users, might not quite understand what's going on. And I don't know if you caught the U.S. president speaking in the House of Commons last week, saying they want to partner with Canada to do more about opioid harm reduction. Mm-hmm. I know that was last week, and that was at a very high level. What more can we be doing as a society and as a province to help folks who might be at risk?
Yeah. I would say one of my personal passions and professional passions, I've been working within the mental health and addictions field since 2007. And one of the most impactful things that we can do as a society is to reduce stigma. And so not treating people as less than or dehumanizing individuals who may be living with substance use disorders or other mental illness within their lives is one of the most important things that we can do as a society. So stigma reduction keeps people safe, and we all have a role to play in that. So creating those safe, supportive environments within our communities to allow people to come forward to access help as they need it, and to feel like they're connected to something as well is extremely important. And one of the things that I think Nova Scotians do well, and we can continue to do that through the work that we do within this program, and as well as individuals in every aspect of our lives.
Ashlie Cormier, thank you for your candor. Thank you for your thoughts today and your information. Is there anything else that we can do to help people find out more?
So I would say, visiting that naloxone website for anybody who does have an interest, and I'll share the link, Sheldon, with you as well if you want to include that. And also just recommending that folks, again, if you're ever experiencing a crisis, to reach out to our mental health and addictions crisis line, as well as if you're interested in accessing any other services or supports that we have available, contacting our central intake, but also just outside of the formal mental health and addictions system within Nova Scotia Health, knowing that there are a variety of community-based organizations who are also there to support individuals, as well as I said before, the role that we play as individuals in terms of reducing that stigma and being open, honest, and caring Nova Scotians is one of the most important things that we can all do.
And Ashlie Cormier, did we touch on everything that you wanted to talk about?
Yeah, I think so, Sheldon. Just really appreciate the opportunity to chat with you about this today. It's something I care deeply about. And for me, if we could save one life through this program, then to me, my work has been meaningful. So I really appreciate the opportunity to speak with you today.